Good morning, everybody. I'm Dr. Sarah McClannahan. I am currently the Executive Director of Behavioral Health for the St. Francis Health System, and I'm happy to go over fitness for duty evaluations with you guys today. Next slide. Here are our objectives for today. We'll define fitness for duty. We'll state reasons why you might request a fitness for duty evaluation for one of your trainees, and we'll describe the process and expectations for the trainee, the program, and the psychiatrist during this process. Next slide. So the definition, a fitness for duty evaluation is a mental health evaluation in which a board-certified psychiatrist provides a comprehensive evaluation to determine if an employee is capable of performing the essential functions of one's job. Next slide, please. So physician impairment, this is the inability of the licensee to practice medicine with reasonable skill and safety as a result of a mental health disorder, or a mental disorder as defined below. So this can be a physical illness or condition, but not limited to conditions that would adversely affect cognition, motor, or perception skills, or substance-related disorders, including abuse or dependency of drug and alcohol disorders. Next slide. So why are we concerned about this? So as physician leaders in our various organizations, we are responsible for the quality and safety of care that are provided by physicians, physician trainees in our organization. Also, accrediting organizations such as the Joint Commission have added standards for organizations to have policies and procedures regarding such things such as disruptive behaviors, peer review, and physician impairment. Next slide, please. So reasons that you might request this would be complaints of behaviors that are raised regarding your trainee or another physician under your supervision that there might be impairment due to some sort of underlying illness. This could be a primary psychiatric disorder such as schizophrenia, depression, substance use disorders, a personality disorder, maladaptive personality traits, medical illnesses with neuropsychiatric symptoms such as conversion disorder, where people might be having non-epileptic seizures, things like that, medical illnesses, neuropsychiatric side effects of a medical treatment, or a neurological illness that impairs cognition or personality. Next slide, please. So what the trainee should expect with this is being notified by their program that they're requesting a fitness for duty evaluation, being the program notifying them that this is not going to be an evaluation that's protected by our typical HIPAA type of protections that we have, that the program will receive a copy of the evaluation. Also, it'll be a comprehensive clinical interview, so the psychiatrist providing this will talk to the individual in a private office setting. There will also be collateral interviews, so the psychiatrist may want to speak with the trainee's attendings or other specialists that have provided care for the trainee. There may be a request for psychological testing to kind of further define things. Typically with this, there may be a request for psychological testing to determine maladaptive personality traits or personality disorders. But ultimately, the goal of this is to determine how the factors of what the trainee is experiencing work together, and to understand if with what that individual is experiencing, they're able to perform his or her job safely. Next slide, please. So the program director is expected to work in collaboration with the psychiatrist as it relates to the fitness for duty evaluation. They may want to communicate with other faculty as determined by the evaluator if they will be contacted. The program director should provide a job description and expectations of the resident. And the program director should discuss with the resident that failure to complete this will result in termination from the program for the safety of patient care and health of the resident. to be put at risk. And then this report will be submitted to the program director to provide an unbiased opinion, the history of interviews and the test results. It's also helpful if the program director can provide any written things, potentially like from the professionalism committee that's detailing the concerns that are provided. So the evaluator has a better understanding of what is happening. And it's also helpful that the program director is helping to explain to the resident, again, that this is not an evaluation that's typically predicted from HIPAA. Like, we will not just provide a fit for duty, not fit for duty, or fit for duty with these recommendations. That the entire report will be provided to the program director so that the resident understands that their information will be shared. Next slide, please. So what you can expect from the psychiatrist, they will provide a comprehensive psychiatric report that takes into account the impact of any of these disabling conditions that the individual may have, the prognosis with treatment, the side effects of treatment, and present and future impacts on the practice of medicine. They will also provide recommendations about whether treatment or professional workplace supervision is needed to decrease the risk of future deterioration of professional capabilities. And they may provide a referral for further psychological testing to kind of further identify and hone in that diagnosis. Next slide. So some nuances, and we've already talked about this, and I know we have other experts that will be kind of sharing about this today. But this is not something that is subjected to HIPAA. And so the medical records in reference to this will be shared with the employer. And it's helpful that all parties understand that. Next slide, please. And then this is, Dr. Som, do you want to review the OSU policy for this?
Sure. So a couple of things. We have an impaired physician policy, and we also kind of detail what we consider appropriate distributing for evaluation. There are a couple of caveats that we want to introduce here as well. Anytime you are considering putting a resident forward for fitness for duty evaluations, it is so incredibly important, number one, to notify the sponsoring institution so we can kind of review and assist if we need to put it through the professionalism committee. And number two, you have to be working with your respective HR departments. Because like Dr. McClannahan already mentioned, sometimes the comprehensive report that you will receive will have information in there that suggests that you need a workplace accommodation. Sometimes if you go through complete psychological testing, they may come up with a diagnosis that requires additional accommodations for a perceived disability to also be incorporated. And I'm not going to get into the nuances of accommodations. I don't want Mr. Dyer get into the nuances of accommodations, but what I will tell you, the basic information, is sometimes if it alters the environment in such a way that the individual is not able to perform their responsibilities, they're not accommodations that can actually be met to successfully complete that training. For example, if a radiology resident, if the accommodation comes back that says the radiology resident cannot be in a dark room for more than 1 hour at a time, you can see how that would be potentially problematic for them to complete their training, because that's a fundamental requirement that they can actually look at a radiology screen and make interpretations for that. So that's a very gross, obvious area where you can't necessarily make that accommodation, but it's something that you must absolutely work with your HR department as it relates to accommodations and disabilities. The other thing that I will tell you is if you've ever been in a position where it's just like, I think this resident is suffering from substance abuse, it's very, very important for us to remove that individual if you think it's going to actually be harming the patients, the resident, the program. So all three of those things end up being on the program director's shoulders to make sure that that environment is really safe and adequate for the training. Dr. McClannahan is correct. An individual who refuses to undergo a fit for practice evaluation or drug and alcohol screening if it's indicated could be resulted in termination. And And so I've been working with Amy Newton, who is our legal counsel at OSU CHS, and we have worked on developing a generic form for fitness for duty evaluation, because Dr. McClannahan and I have been working together just recently as it relates to making sure that residents can be seen in a timely fashion. Because a lot of times if you're looking for fitness for duty evaluation, it can be 3 months out, 6 months out, and then you're removing that residency from training and what you do with that resident at time. And so Dr. McClannahan has agreed to kind of help us get these in a more expedited fashion and comprehensive evaluations for the resident can be addressed. And in addition to that, she's also worked on waiving some of the astronomical costs that are associated with getting a fitness for duty evaluation. Sometimes these fees can result in like $2,500 or greater for this complete evaluation to be completed. But Dr. McClannahan has agreed to bill insurance and maybe have an additional $250 fee, which is, it's a big thing, and we're really grateful for the partnership that we can have with St. Francis as it relates to this, because she's also an individual that's not providing direct resident training, so it takes out that perceived conflict of interest. The other individual that we have determined to be qualified, obviously, for performing a fitness for duty evaluation is either a board-certified psychiatrist or a forensic psychiatrist. Those are the individuals who have the additional expertise required to perform this. So it shouldn't be a licensed social worker. It shouldn't be a family practice provider unless there's actually demonstrated evidence of additional training for fitness for duty evaluations. In the form that we've created, it's almost a blanket, like, hey, here are the things that you should expect. Here's your consent for going forward with this. You understand that the cost is going to be on you. You understand that you can't return back to work until you've actually completed this. And you understand that after it's been completed, if there are additional findings that come from comprehensive evaluation, you may be required to return back for repeat fitness for duty for evaluation to be assumed safe to return back to your clinical environment. The individual that is providing the fitness for duty evaluation is not the screening provider. And that becomes very important for the information that Dr. McClannahan just mentioned. It shouldn't be protected for HIPAA because it's important for us to determine if that individual is safe to practice in their clinical environment. And the other part that becomes really important, be very careful when you're talking to your residents. You shouldn't be saying, hey, they're just going to give you like a release to work note. That's going to be like 3 sentences that says the person can come back safely to work. It's going to be the entire report. We've had a couple of experiences now where they're like, well, we don't want that included, or we don't want this included, and no. You know, my program doesn't expect that. No. The program expects the provider to perform fitness for duty evaluation and provide the information necessary for the employer to determine if it's safe and possible to return that individual back to their clinical learning environment. And so this becomes a really, really important time, again, for me to emphasize that you be working very closely with your HR department because they're implications from that. I don't have the final draft of what I think we may be able to use for the fitness for duty evaluation because there's been a lot of back and forth. After I've completed it, I'll probably submit it to Mr. Byer for the OSUMC side. I strongly encourage that at the other programs, you submit it to your HR departments to be like, hey, this is something that we can use. Is it something that we can't use? Is it something that we need to modify? Because we would like to make sure if you're doing something from your sponsored program and coming back to the DIO's office, we want to make sure that we're in agreement with the content and what's the expectation of the provider performing the evaluation, the resident, and the program. Does that make some sense? So fitness for duty evaluations ultimately is to determine if the individual can return back to clinical practice. There's not a threat to the resident, to the program, most importantly to the patient. A lot of different things can trigger, and if you're considering thinking that this individual may need a fitness for duty evaluation, I strongly recommend that you consult with our office if we can see your resources or make your recommendations. Is there any other additional?
So I think the biggest thing, Dr. Som has my contact information, and so it's probably easiest if the program director initiates that contact of, hey, we need this, and then we can coordinate with my office. I pretty much set my own schedule because I don't have a dedicated clinical practice, so I just build the appointments into my schedule and have the scheduler schedule them. But if you'll reach out to me, we can discuss getting that scheduled for your trainees.